Hello, I'm Dr. Jackie from Sante Medical, and a common scenario I see is some patients can still have some signs of insulin resistance even though they've been following a low carbohydrate diet. So in this video, I'm going to discuss what we should do in that situation. How do you know, first of all, that you might still be insulin resistant? So the most common sign we'll see is that you're still carrying a bit of extra belly fat as to what you'd like. And your waist measurement might still be elevated. We can also see some evidence of insulin resistance in your blood tests. So perhaps your triglycerides are still a little bit high, or you've still got some high blood sugar and or high fasting insulin. So what we can do if that's the situation is three main things. So number one, I always check that people are including some sort of strength training into their program. So it might be good, if they're doing walking or on the bike, but we need at least 2 or so dedicated strength training sessions per week, and that will improve what we call peripheral insulin sensitivity. So it will make the muscles more sensitive to insulin by doing that sort of exercise. So what I'm describing here is something where you'd be using big muscle groups, just doing 2 or 3 sessions per week maximum, doesn't have to be every day, and 3 sets of about 10 repetitions approximately, and by the 10th repetition you're pretty close to failure. So the second thing to look for if you still have some insulin resistance despite eating low carb is to check in on your sleep habits. So we know if people sleep poorly, they can have a rise in cortisol, and over time, there's studies that show in shift workers, they will tend to be more insulin resistant than the normal population and suffer the health consequences of that. So definitely prioritize sleep, wind down at night, get rid of screen time at least 90 minutes before bed, and that in and of itself will improve insulin sensitivity. Now, the third and final thing I will sometimes consider if someone is still insulin resistant is to think about using some Metformin. So this is actually a prescription drug. It's been around for a long time, but it helps reduce the amount of glucose produced by the liver, and it also helps improve insulin sensitivity. So sometimes I'll get people to start on a low dose of Metformin, which can help with their insulin resistance. So that one obviously you'll need to talk to a doctor. Our doctors here are experts in treating insulin resistance. So if you want to come and talk to them about any of these strategies, then book in using the link below, and we will see you soon. Thanks, I'm Dr. Jackie.